Hello everyone, we are back in Hannibal now, and we're actually visiting the Hannibal Free Clinic. The Hannibal Free Clinic serves all 5 counties that United Way of the Mark Twain area serves, including Lewis, Marion, Monroe, Rawls, and Shelby. But we're going to go inside and learn about the work that they do here at the Hannibal Free Clinic, so you guys can learn all about their great services to people in our community. So let's go on in. So with us today, we have Sharon Webster and Haley Hurst, who, Sharon is the clinic director here. She's the executive director of the Hannibal Free Clinic, and then Haley is a pharmacist who is staffed here at the Free Clinic as well. So really, ladies, can you just tell us, what does the Free Clinic do for people within our community?
Well, we provide basic office health care to adults between 18 and 64 who do not have insurance, Medicare, Medicaid, and cannot qualify to get any of those, and it is unable to purchase insurance on their own.
And so free health care services, and what kind of maybe health conditions are the majority of people coming to you to treat?
We do a lot of chronic, healthcare management. So we've got a lot of diabetes, we've got a lot of high blood pressure, high cholesterol, asthma, COPD, that kind of thing. Things that you typically go to like a primary care doctor for, anything like that we will do here.
So if I don't have insurance and I need stitches, I don't come here though?
No, we do not have a walk-in system. It's all by appointments, and we only have providers on certain days when they volunteer.
And so your providers are volunteers?
Yes.
Can you tell me a little bit about that?
Well, everyone, I am a donation from Hannibal Regional Hospital to be the clinic manager.
As am I.
And as is Haley. And then I believe Susan Watson commented that we lease Linda Chow to be our front office manager. She, started with us as a temp, and so then when we realized we needed her full time and we wanted to be able to offer her benefits,
and we loved her so much.
Yes, we didn't want her to leave us at all.
She's listening.
But so the hospital was willing to hire her, and then we pay the hospital back. But we are here, everybody.
We're the only 3 that are paid.
Yeah, we're the only 3 that are paid. Everybody else that comes here is a volunteer. The medical providers, the chiropractor, the office nurses, the
front office help.
Everybody is a volunteer.
Yep.
And how many patients do you guys see, or how many visits do you normally have a year?
There's usually about, if we count all of the patient-centered medical home and the the chiropractor, everything, we probably have between 900 and 1,000 visits every year.
Wow, 900 and 1,000 visits. And so how many doctors are currently volunteering?
Currently we only have 4. We've had a couple of people who moved out of the area or retired, so we're kind of down. We have another doctor who in the past has expressed interest. It's just trying to meet up with him and find out what his schedule is.
But we're always looking for more. So
That's
if
right.
you know someone.
Yes. Yes, if you
call
know
us, 573-248-8307.
That's right.
So doctors, volunteer doctors, certainly.
Yeah.
And then you have a chiropractor. Can you talk about that?
Dr. Dennehy is our chiropractor, and he comes over he's retired from his practice, but he still comes over once a week and helps people that, have chronic pain or something like that. He helps, get them back and, into the alignment to help relieve that pain.
Absolutely. And also, on occasion, you have some dentist work that is done here as well.
Yes. Our local dentists have been incredibly busy in their own lives and their own practices, so it just hasn't worked out. But we are now working on an arrangement with the dental school in Kirksville for them to come. They did a community clinic here in February, and our clients were so thrilled to have them here. They were just we did some extractions, we did some cleanings, we did some fillings, and we're working with them to try to either have routine community clinics here, or even become part of their clinical rotation so that they would come here.
Absolutely, which is so great. So
Yeah.
nonetheless, a lot of free healthcare services to individuals who qualify within your income guidelines who don't have insurance, and you can treat all the chronic conditions.
And we work with Clarity because we don't have any mental health services here, so we work with Clarity. We can, if someone needs counseling or prescriptive services, we can, refer them over there, and we help pay for that cost. We also encourage healthy lifestyle through a partnership with the YMCA. We pay a portion of their discounted membership, but they also have to pay a portion of it, and they have to go
8 times a month.
8 times in a year, in a month. We also use some of our donations to buy some healthy food. A lot of, food banks are wonderful and they are a staple in the community, but unfortunately a lot of times that stuff is processed and high carb, which for our, diabetics and heart patients, our people with diabetes can't, do all those carbs.
Absolutely.
Could you benefit from donations for your healthy?
Yeah.
What are some things that you would like to see?
Canned vegetables, canned meats or proteins, protein bars. We try to steer away. A lot of our patients that we're, giving food options to would be people who have diabetes. So we try to do low carb items, not Oreos, that kind of thing. More healthy options if possible. Also, what makes healthy food hard too is it's perishable, and so trying to find healthy options that are more stable just for our purposes here, and then also when we give them to patients. So canned stuff is really good, or frozen stuff. We do have a fridge that we could use to store that too, but anything like that would be appreciated.
Yeah. And we don't limit it strictly to our patients that have diabetes.
No.
Because there's a lot of food insecurity in general. We're not a food bank that's open to the public, but, if our patients are here and they're, expressing to us that they're, struggling, we will help them as much as we can.
And I think food insecurity is part of healthcare. A lot of times that is part of, and especially with the low income population you're talking about, anyone who's been to the grocery in the last few months has realized that cost, the high cost, and so that's just one other kind of side project that we have here. So yeah,
You guys do a lot of good work, of course. Why do you guys show up every day to do your job? What is kind of your personal mission here? What's your why?
Ooh, that's a loaded question.
Yes, it
oh my
is.
gosh, and it's live.
Yes.
Whew, it's hot in here.
Yes.
It's just helping people, giving them a hand up instead of just, people think, oh, well, it's a free clinic, it's only a handout. It's actually hand up. One of our patients, we have just found out that she's starting nursing school. So, and she had struggled with, multiple health conditions and paying for her medications and things like that. And now, we kind of got her.
Until she got her health care under control,
she was in no condition to go to school.
Yeah.
And so it's seeing the positive outcomes within our patients that really keep you motivated to come.
And I would say too, like being a clinic where you do chronic management, you kind of get to know your people, and you get to know them on a personal level in addition to their healthcare stuff, and they grow to trust you and know you, and so being there for them and being that reliable person that they can come to it, and they trust you, and they're, gonna ask you for help, even if it's not healthcare things, which is why it's important that we learn about other things, because a lot of time in the community, people are asking about housing, people are asking about food, so knowing what other resources are available in our community is good for us too, just so we can send people in the right direction.
And our volunteers are awesome too, because our thing is, if you call us, if you're our patient, if you're not our patient, if you're just calling to ask a question, and we can't fix or solve or enroll you to be our patient, we still don't want to hang up until we have given them an alternative.
We're fixers.
Yeah.
We want to. We
I love it.
We want to have something.
Yeah.
I agree, and that goes right along with our campaign slogan this year, that everyone can help someone. So you guys definitely embody that. So we encourage everyone watching today to participate in our campaign. You can volunteer or bring in donations here to the free clinic, like they gave some suggestions, and be a part of our campaign this year because everyone can help someone.
Thank you, ladies, so much for
Thanks
everything
so
you
much.
do.
Oh, well, thank you.